It's been an exciting opportunity to network with individuals, understand their trials and tribulations, their experience in their healthcare journeys, and also to learn from some various technologies and experts on how to improve healthcare within my organization. It is an honor and privilege to be here with such talented individuals.
The technological issues as part of healthcare professionals' work is my passion. And I think in this conference we have had a good view how the technology is changing the nurses' work, changing the patient's role, and also changing the working environment. So you are not just working in the hospital, you can work at the home or even in a bus or some other place. And I think in this conference it has been very fruitful to meet kind of senior nurses, educators, researchers who share maybe a different viewpoint. But that's all about technology. You can't change the world. You can change some part of it, and some elements are left as they are, like feeling empathy or some other issues which cannot be changed as a technological innovation yet.
Since coming here today was the first of a 3-day conference on nursing that is very broad. There was no one speciality, so it was very interesting to hear all the different experiences of nursing from different parts of the world.
I've been attending this nursing conference, and it has been a very great experience, meeting people from all over the world and with very different perspectives. We have had a lot of discussions, and it has been a very great experience.
I'm here today because I conduct a lot of medical missions across the world, and I wanted to look and listen to the dialogue of all of the different presenters from across the world on the trends that they have that are different than we face in the United States, but at the same time those that are the same. For example, looking at the substance abuse in women and children, looking at the opioid crisis that's happening across the world. A lot of times we believe that these problems are unique to us, but when we come to conferences and meet other professors and nurse scientists, we find out that we have very similar problems. When we come together in conferences like these, we can learn how to better serve our growing population, and a population that's becoming closer and closer together. We look at it from a global perspective, then we can learn how to better serve the world, but not just our individual cities or countries or villages. So when we look at the village as the entire planet, and we come to conferences like these, then we can learn how to work better with the trends, how to connect with scientists that is already doing the work that we may need to conduct in our own areas, and how to be able to offer our assistance and our expertise in areas. For example, I can go because I have a PhD looking at health disparities and health policies. I can go and help the Aborigine people in Australia, or I can come here to Spain or to Zambia. I just actually left Morocco, and when I leave here, I go to Rome and to Qatar, where I'll be helping the Qatarians with diabetes. So again, coming to health conferences like these is very important so that we can learn from others to improve the health status for individuals across the world.
We are very lucky because there are nurses from all around the world. We have the opportunity of sharing knowledge, ideas from different disciplines, always during the inside of the field of the nursing. But there are also some engineers, there are physicians, there are psychologists, there are so many people that they are able to share their experience, to share their knowledge. So really, I am very, very happy to spend these 2 days here. I have been sharing one table, having so important for nurses to have time and space for talk and for sharing what we are doing.
This is the first time I've come to this conference, and which I really wanted to come, and that's why I came from Zambia. It's a long way, but I said, let me go and meet our colleagues. So I'm really interested. And I'll continue. I've seen it's in Rome, already advertised. So I'll also ask my friends so that they can come with me, so that we learn these issues that I have been experiencing today.
In research field, obviously we have to be research active, because research actually leads to all the changes that happen in healthcare science, and research actually leads to development of not only personal but also as a profession. We need to be very, very active in developing research and education. And I would like to thank you all for inviting me to speak at this conference, which I thoroughly enjoyed, and the response I received were very encouraging. Thank you very much.
We are very happy to be here. We enjoy our days in this Congress. We meet a lot of people, and we have the opportunity to share our studies, and also to listen other experiences from all the world.